So in this video, I'm going to show you how to properly apply the Smart Cuffs BFR on your leg. So if this is the leg that we're going to do BFR on, what we need first is you need the right sizing that you usually got from your lab that told you which size to use, and also the pressure that we're going to inflate to. For me, we're going to say that I'm using a size 4, and the pressure I'm going to inflate to is 130 millimeters of mercury. So for my right leg, the first thing we're going to do is you're going to try to get it as high up into your groin as possible. So you don't want it down here, lower on the leg. You want to get it up as high up as possible. It can go on the clothes or on the skin. It's kind of up to you, whatever you feel comfortable. This is a lot of elastic, a lot of Velcro. So you're going to undo the Velcro. You're going to put it up as high as you can. You're going to stick it through the strap. These little tabs, you're going to open up the tabs. The big key is right now this valve's on the outside. So that means that it's not going to actually get in the way. If I had turned it this way, I may be sitting on the valve and I don't have access to it, or if it's inside, it's just hard to reach. So you want to get the valve either on the outside or on top. I'm going to cinch this down so it's snug. It doesn't have to be overly tight, but definitely where it's snug and it's not going to slip. The Velcro is going to go down, and the little tab's going to go on top. You notice how high it is on my leg. It's not going to be down here. It's as high as possible. Once I get that set and I feel like I'm ready to go, I'm going to take my gauge. I'm going to stick it in. You should hear a little snap. That's how you know if it's in. If you're having problems with the snap, you can just push the little metal part and it should go in, or push it down with your thumb and stick it in. Now, to pump up a gauge, it's normal like a blood pressure cuff. So the first thing you have to do is make sure it's closed. To close it, you turn it towards you. To open it, you turn it away from you. If it's open and you're pumping, you're going to hear air going in and then leaking because it's open. So you need to close the gauge completely. Once the gauge is closed completely, then we could start pumping. The big key here is I'm in a relaxed position because I'm lying down. You need to be pumping in a relaxed position, meaning my leg's not tense. I'm not holding it up here. I'm completely relaxed because that's the same way that you measure it initially. So if my target pressure is 130, I'm going to do 1 pump per second when it's closed, and I'm slowly going to make our way all the way to 130 millimeters of mercury. As it starts to pump up, I'll feel the cuff kind of get tighter and tighter around my leg, just like a blood pressure cuff would. It's totally normal. So I'm getting close. I'm at 80, I'm at 90, I'm at 100, 110, 120, and then I'm at 130. Once I reach my target pressure, I'm going to squeeze my leg, my thigh a couple times like this, and then I'm going to try to bring my knee up and down a couple times, and what you're going to notice is that the pressure will drop ever so slightly. And that's just the air going into this little overlap area. So now that the air drops slightly, I'm going to keep my leg relaxed. I'm going to pump it back up to my target pressure, which we said was 130. Once I reach 130, what's really nice is I can then push this little metal tab and I can take it off, and now we're ready to perform BFR training. Now that I'm at 130, I can do the exercises for the protocol. Once you're done, there are 2 ways of getting pressure out. What's nice is there's a little safety valve here. I can just push it and it can take out a lot of air really quick. But to get all the air out, or you're going to want to put the gauge back on, hear the snap, you're going to want to open it, which is turning it away from you, and all the air will start to come out. And that's how you inflate and deflate your BFR cuff for the legs. Again, I can kind of help it push it out, and we're good. And then detach.